in Nigeria. Entirely, I hope I got the name right. Entirely. Okay. I'd rather call you Ekwen, right? Okay, thank you. So, your question is what to do or not to do with the rains coming. Unfortunately, we never had this before. You would need a cycle for you to be able to establish that this is what will happen this time around. This is just the first experience. So we didn't have COVID last year. During the rains last year, as to be able to say this was what happened then. So we have to wait and see. But having said that, the usual or the routine advisories should still be kept faith with. That is, washing of hands, soap and water on the running water, use of sanitizer, alcohol-based, use of face mask, avoiding gathering, physical distancing, and all the other advisories that we'll be giving. So we want Nigerians to continue to follow these advisories. Yes, it's been said that there is a possibility that high temperature, humid environment, and what have you may aid. But again, these are some of the things that have been said. But regarding what we know, I think the advice is that keep to those advisories and maintain the hygiene, both personal hygiene and respiratory hygiene. I think that's my response to that. The second question is the update on Cross River and Kogi. Well, Kogi is yet to be visited the second time, but I can say that we have a better understanding with the government of Kogi this time around, and we're hoping that when the team visits Kogi, we will have a better report based on better understanding. For Cross River, yes, we want to commend the governor for welcoming the team and for the collaboration that took place and better understanding as well. But essentially the findings at the end of the visit, they revolve around the issues of security at the border, inadequacy of surveillance system, and the low capacity for testing because of death of personnel to make this testing possible. Of course, what was also observed was that the call center is probably not what it should be. It is yet to, it's still being set up as at that point in time. The situation may have changed now because this was a report about 2 weeks ago. There was also the issue of difficulty in shipping test samples from Cross River to Irua, which is possibly the nearest center, the Irua Reference Lab, taking these samples from Calabar to, so logistics issue was one of the other things observed in Cross River. But at the end of it all, there were discussions around how to mitigate these gaps and challenges. And like I said earlier on, we want to acknowledge the cooperation of the governor of the state in trying to ensure that we both work on the same page, that is, between the federal and the state authorities, with a view to getting things done properly for the good of us all. Thank you very much.
So thank you. After my minister's elaborate answers, I'll keep mine very short so we can all go home. I think the first question, Friday, on the 45 days, I think my minister has answered it. If it was now, the patient would not have stayed 45 days. That's the impact of the science coming out now, that the virus is not viable after 10 to 14 days. But the test can remain positive. So if we knew now what we knew, if we knew 2 weeks ago, 3 weeks ago what we know now, she wouldn't have stayed 45 days. But that is how new knowledge emerges and influences your decisions. On Kogi State, like I've always said, we are focused on supporting all the states in the country. And our focus will continue to be states requesting and the people living in those states. Every day, almost every single day, I'm having discussions, calls from governors pushing for labs, pushing for treatment centers, pushing for commodities, IPC, technical support, guidance, knowledge. So our hands are full dealing with states asking for our support. The purpose for our existence is to support the state, and we'll continue to do so. The third was on the positive in returnees. Yes, we've had only 3 positives in that first flight that came back, I think, through Lagos. All the ones that we've tested in Abuja over the last few days have all been negative and discharged home to rejoin their families. In terms of reagents, at the moment we have reagents to test over 100,000 people in our stockpile. So the challenge now is not reagents, the challenge is really to work with states to reinvigorate the sample collection process. And this is our focus, the focus of our work this week. I sent out a message to all state commissioners of health in all the states and all their state epidemiologists over the Salah holiday to really focus this week on getting in more samples so that we know where they are. In Imo State, we just saw a small but significant increase in the number of cases because of their increased testing and the fact that they now have a lab in Owerri. So we can see how the availability of a lab and proximity to testing changes the response. On the cost per test, this is really sometimes not as simple as you think because it depends on what you include in the cost. So if you ask how much it costs to put this event together, you can just cost some of the operational costs. But if you now cost all the time and our opportunity cost, the human resources, the electricity, the generator, the air conditioners, you come up with a completely different set of costs. So it really depends what we are costing and what the Lagos State Commissioner is costing when he's referring to the cost of tests. The cost of tests for one individual in terms of reagents is still about $20, and you can convert that to Naira. But if you now add the cost of equipment, human resources, generator, internet, and all those are important for keeping the service working, hazard allowance and all that, then you come up with a different set of costs. So the $20 cost per test is basically what it costs to pay for the reagents and commodities required for that single test. Rachel, excellent. I'm happy that you're doing a lot of reading in your spare time. Yes, that study came out of Singapore. We encourage your colleagues to all do the same, and I'm sure they all are. There will be a lot of masters in public health to be awarded after this session of our work in Nigeria. The question about the WHO statement on face masks. It's not that WHO says that face masks are not to be used by the healthy. I think what they're saying, and if you read their guidance carefully, is that face masks don't really, the value of face masks is protecting those that do have the virus at the early stages of their infection from preventing others, or from infecting others. That is the biggest value that face masks have. So if you're in a room where the person that is infected is not wearing a mask, and you are wearing a mask, that mask might not protect you. The biggest value is if you are infected and in early stages and you don't know, that's the biggest value of a mask, and that's why it's important for everybody to wear a mask, and that's where the real value of masks come in, especially when you're outside your home. Yes, we had the report in Bonny, and we are testing at the moment. We've sent a team there. They've collected samples. The samples have arrived in the lab in Rivers State, in Rivers University Teaching Hospital. So we should know by tomorrow or next if it's COVID or not. And finally, we're supporting many sectors in their guidelines. Where's my sister that asked the question? Okay, yeah, just behind you. We're supporting many sectors in doing the guidelines. And these are not only those that asked us, we're also proactively writing and supporting specific big sectors. Aviation, education, these are ones that we can't wait to be asked in terms of how we support. So we're going to actually approach them and offer our guidance and support. But in this case, really, you will see that everybody in the world is grappling with the same issues because they're not straightforward. And there's often not enough scientific evidence to base all our decisions on. So at some point, our leaders have to make very tough decisions. But that's why we elect them as leaders, to direct us and to make those hard decisions. Do we open or not? Schools, airports, train stations, and rely on us to enable the safety of what they've advised us to do. Of course, airports are easier than schools because we generally think that adults are more adherent than children. That is not always the case, but that is the general assumption, and that's what makes the reopening of schools so difficult, because the whole idea of keeping 2 meters apart is not something most children really would easily understand. And sometimes not all adults understand either. So thank you very much.
I believe I have a few questions. So the first one has to do with the doctor that was assaulted while on essential duty. And we are hearing this for the first time, but any sort of assault is unacceptable. It's an unfortunate situation. We hope it will be investigated by the relevant authorities, and we will keep on asking all law enforcement agents to make sure that they treat members of the public in a humane and respectful manner. We haven't been approached yet, but we hope the person affected will put in unnecessary complaints through the usual channels, and this will be addressed by the security agencies. In terms of the question about the different strains of COVID-19 and whether or not we are looking at these strains, so far, at the moment, there's no strong scientific evidence that the two strains, we have the L strain and the S strain of coronavirus. There's no strong scientific evidence that these two strains behave in different ways when it comes to the severity of illness. As with all viruses, we know that as they multiply, as they replicate, there's always error within their nucleic acid. And this error accumulates over time. And the error could lead to either the virus becoming weaker, such as with HIV, or sometimes it could become even more potent. But generally speaking, with mutations, what usually happens is if you have a drug or a vaccine that affects, that targets a specific viral protein, and that viral protein changes because of mutation, then that interaction between the viral protein and the drug or the vaccine will weaken, and therefore the vaccine will become less effective. But these are still early days in terms of research, and there's certainly no strong evidence that the two different strains of coronavirus behave differently in the host. With regards to Rachel's always difficult questions about reserves for PPE quantification. So we have done a complete quantification of our needs as a country. We are discussing with the donor community. I don't have a figure for you at the moment in terms of what our current amount is. Rachel, if I did, I'll be a working calculator, but we can get that data for you, certainly. As you're probably aware, it's a dynamic and fluid situation. What I can say is that we have more PPE now in country than we used to have. So we are in a much better position. NCDC usually deal with the logistics side of PPEs, and they have an automated system that allows them to keep some contingency reserves in place in case other parts of the country need such material urgently. And then finally, I wanted to clarify what the Honorable Minister of Foreign Affairs said with regards to people coming in country and being quarantined. And as the Honorable Minister of Foreign Affairs said, the proposed changes are not in effect yet. They will only come into effect when everything is in place. So for the moment, if you are coming in country, the current arrangements stand. You will be quarantined for 14 days. The people that are currently quarantined are not going to be discharged on the basis of this proposed changes. We have not started implementing them, and as he said, it will require some form of testing before even boarding the flights. So this is still work in progress, and we are yet to put this in place. So just to clarify really and make that very clear to the public. Thank you.
Honorable Minister of Foreign Affairs.
Thank you very much. There are a number of questions there. Okay, also what the national coordinator just mentioned, of course I did say that that all this has to be in place first. But of course there's a backlog of people waiting to come into the country. And my understanding, again, he might wish to clarify this, is that we are to suspend all evacuations until this new protocol comes into place. But if there is a change of policy, that evacuations can continue pending the coming into place of the new policy, then of course we will start looking at evacuating Nigerians. But the understanding and the directives we got was that all evacuations are to be suspended until this new policy comes into place. So the situation of evacuees coming in to spend 14 days in quarantine would not arise, because we've been directed to halt all evacuations until the new policy comes into place. Now, the other questions that I received was how many positive tests were recorded amongst all those who have come into, all the evacuees that have come into the country. Of course, you know that we had evacuees from the UAE, the UK, the US, Saudi Arabia, and Lebanon. And to the best of my knowledge, only the 3 cases that were reported in respect of the UAE in Lagos were the only positive tests that we had. So all the others were negative. Then also the other question was about the Canadian evacuees and Air Peace. Now the situation there, as you all may or may not know, is that Air Peace had wanted to go and evacuate a large number of Nigerians, and possibly also evacuate Canadian nationals from here and take them to Canada. There was an issue with the landing clearance for Air Peace. Our High Commission in Canada engaged with the Canadian authorities. I called in here in Abuja the Canadian High Commissioner to understand why Air Peace was not being given landing clearance. And the explanation, and I won't go into the details of it, was essentially that Air Peace did not have a track record of going to Canada, and so the whole profile of the carrier needed to be fully ascertained in respect of all the important aspects, security, and so forth. And I was informed that the process of getting an eventual approval would obviously be a long one. And so essentially, it was not possible for Air Peace to go and evacuate these Nigerians. But what is not correct is that we had now allowed another airline to bring those Nigerians back. That's not correct. What the situation is we're exploring with Nigerian carriers to see what kind of arrangements they can make amongst themselves, and looking at other options that they would be involved in identifying for the evacuation of those Nigerians. So, we have not taken a decision to allow a foreign carrier to bring those Nigerians back. The third question was in regards to compensation to Nigerians who were caught up in Guangzhou during the crisis, that seemed to be targeting Africans with respect to having tested positive, or and also with actions that were considered also discriminatory on the basis of nationality and race. What I did in that case was I spoke to the Consul General, our consular representative in Guangzhou, who was in direct contact with the Nigerians there, and asked that he should contact the Nigerians involved, or make it known to them, to provide details of any loss they might have suffered, and any other claims that they might have, and to provide that to the ministry, and we would engage on that basis with the Chinese. And I might add that when I summoned the Chinese ambassador, he also made this commitment that they would be very interested to receive the details of any complaints of loss or whatever. And I must say that to date, nothing has come in formally from our consulate in Guangzhou. Then the other question was, again, number of evacuees who tested positive, which I've just responded to, and also how many evacuees have returned. The evacuees that have come within the framework of this PTF program, because there have been sort of small individual cases of people coming in, but not within the framework that we are responsible for. I would say around 1,000 persons have come in from 5 countries, and that's not counting the land border, where you'll recall about 100 or so people came in. We brought in through the land border. Thank you very much.
Minister Environment.
There were 2 questions. One, whether we will decontaminate and disinfect schools before they open. That's primary, secondary, and tertiary institutions. Yes, we will. Secondly, whether private entities that want to decontaminate and disinfect their facilities can hire environmental health officers to do so, and that they are being charged exorbitant prices. Well, about pricing, the Federal Ministry of Environment does not set a price. However, the most important thing is we set the standard. For you to hire anyone, it must be a licensed, qualified environmental health officer or company. And this licensing is being done by the Federal Ministry of Environment through its agency, Environmental Health Officers Registration Council of Nigeria. Anyone that has no registration, be sure you will be dealing with an amateur that can cause a lot of problems for you. Chemicals, I think that we must handle with care. And these chemicals must be United Nations approved and recommended by the World Health Organization. So no matter how chemicals are, no matter how good they can do for you, they can equally do bad if not handled carefully. A gurguje, abin da yasa zan yi da Hausa, tambayan ta ƙarshe da aka yi ta farko shine idan za mu tsaftace, za mu feshe makarantu duka, za mu yi da primary da secondary da jami'o'i, amma tambayan za ka iya samun waɗansu ka biya su sai maka kuma suna cajan kuɗi da yawa. To kuɗi ba yanda za mu yi akai, ba mu muke sa kuɗi ba, amma ka tabbatar duk wanda zai maka aikin feshi to yana da license daga ma'aikatan muhalli, cewa ya ƙware ya san aikin, domin aiki da sinadarai ba ƙaramin abu ba ne. Duk irin amfanin da za su yi maka kuma za su iya cutar da kai. Sinadaran nan dole ya kasance sinadarai ne waɗanda Majalisar Ɗinkin Duniya ta amince da su, kuma babban ƙungiyar lafiya ta duniya ta ba da shawaran a yi amfani da su. Saboda haka mutum ya san duk wanda ya kira zai mishi wannan, ya nuna mishi, ya tabbatar da ga ainihin laisensi da ya samo daga ma'aikatan muhalli kafin ya bashi wannan aikin, don kada mutum ya je ya kwana a ciki, garin cire cindo a hada da yatsan a tsinke. Salamu alaikum.
Honorable Minister of State Education.
There are 2 questions, and I think both are related. In asking what we do to follow up on students who we've introduced to this e-learning or the online platforms. First, the Ministry of Education, in putting out this standardized teaching modules, also has an M&E component, a monitoring and evaluation component. And I did refer to the ICT director and the director of basic education. All of them are working with the Universal Basic Education Commission via the SUBEBs to give us a feedback as to what it is they are doing. There's nothing we're going to do to either shut down schools that do not do it or beat them up or so on. This information, the feedback we get, only informs us as to how we can help further. And sometimes we commend people who have done what, a little bit more. For instance, in Abia State, on Radio Abia, the governor of the state came to teach biology. Now, that kind of feedback may not necessarily be what we have asked him to do, but his presence alone inspires other people to come learn. And the monitoring we did of Abia State did not even come from Abia State. It was from way out in Enugu State, where people were listening to that program. In Akwa Ibom State, they were listening to the program that the governor of Abia State was teaching in biology. Now, he was treating our syllabus, and we expect that type of interaction. When I spoke earlier, I started out saying we were commending mothers, because truly speaking, in every station where I've spoken about this, I go back to asking parents to please help us. Mothers are the bane of it. They are doing the most they can, just getting a child to sit still. I'm not sure if you have children, but if you do, just getting them to sit still and listen is almost part of the entire 10 Commandments. So really, children are like that. They're energetic people, and I can imagine what parents have gone through in the last 3 months, just getting them to learn. However, what we are doing, and in assisting them, is that if there are feedbacks, if you look at some of the online facilities, some of them have a feedback mechanism where teachers and students can interact. Those that do not have, like you pointed out, radio or otherwise, we've had phone-ins, we have people writing us. The Ministry of Education, people are still reacting and helping fine-tune times and schedules for all the radio and television stations around Nigeria. Thank you very much.
Finally, we take the chairman of the PTF, the SGF.
I think most of the questions have been dealt with. With regards to the security allowances that Nancy asked, I want to assure you that everybody that is involved in this national response, either as a frontline medical worker or a security agent, everything humanly possible will be done to ensure that the little stipends that they are entitled to as allowances will be paid. It's just a matter of process, and I can assure you that that is being processed. You are aware of the fact that the National Assembly is even cutting short its recess to reconvene tomorrow to consider the 2020 adjustment in the budgets. You don't begin to apply certain amounts of money. You wait for certain approvals, and I believe that as we are processing it, by the time that the leadership of the National Assembly consider whatever adjustments that are going to be made in the budgets of the Federal Republic of Nigeria, which has become of necessity because of the economic impact of COVID-19, I can assure you that everybody will be paid their little entitlements. It might not be commensurate to what is expected, but as a sign of understanding and also regard for the people that have been in the front line, these allowances will be paid. Schools opening, I didn't say soon. I was very careful about the choice of my words, and I believe that the Minister of State Education too didn't say soon. And I know that you always get a copy of my statement. If you look at paragraph 5 and paragraph 6, I was very, very careful about the choice of my words. And I said that we will put all measures in place for safe reopening of our schools. And that the Minister of State was going to make clarification on that in the same paragraph 5. And in paragraph 6, I was also very, very careful about urging states, local government proprietors, and other stakeholders to begin to take steps that will facilitate an early and safe reopening. An early and safe reopening. That is very, very important, because we do not want to use our children as prospective carriers of this virus when they congregate in their schools and when they return home. The elderly, the weak, the sick, people who have comorbidity that we are trying to protect, we use them as carriers to come back home and infect the elderly and those that fall into the category of the 20% that we've been doing everything to ensure that we secure them and protect them, because they are the ones that are likely to fall severely sick. And the fatalities too are a percentage of the 20% that if we do not do everything humanly possible to secure, we would expose them. There was a question, I think, which I'm supposed to respond to in Hausa, but let me answer in English, that has to deal with the predictions of the FAO, the Food and Agriculture Organization, which is an organization under the United Nations. It's very, very true. We're expecting an invasion of locusts, particularly in the northern part of the country. And the federal government was proactive. On the 11th of March, that was the second to the last physical Federal Executive Council that we held. A decision was taken. A memo was presented by the Minister of Agriculture and Rural Development, where he had brought for consideration, and it was taken and approved, a total sum of about 13.9 billion naira to deal with transport test and surveillance and monitoring, and also control of transboundary animal and pest diseases, and rehabilitation of major abattoirs to provide for sanitation in those places. That memo was taken and passed at the Federal Executive Council of 11th March 2020. So we are trying as much as possible to ensure that, and I believe that it is at the point of execution now that we take control of the invasion of particularly locusts at this time of the cropping season, because the invasion of locusts can be very devastating for places that particularly depend on grains and sorghum and other forms of cultivation. So I think that is a thing that we have taken care of. The contract has been, the council has approved the award of these contracts. And finally, Mitare, you asked whether the National Electoral Commission is moving towards the processes of enshrining e-voting in the country. I can say yes, that is the future. Whether we like it or not, we must begin to make preparation going in that direction. And I can tell you that this did not start today. In my few years, I've had the privilege of serving in 2 of the several constitutional conferences. I first served in 1988 as a member of the Constituent Assembly that framed the 1989 Constitution under the Babangida regime. And I knew that was a very strong subject of discussion. How do we reduce the costs of our elections. Not only the cost of campaigns by the candidates, but the cost of even conduct of the elections. Because we realized that we spend billions and billions of naira in buying ballot boxes, in printing ballot papers for all forms of elections. And that was a major source of discussion at that moment. But we came to the conscious realization that our infrastructure was not able to carry the processes of electronic voting. Don't forget, in 1988, there were no smartphones. We didn't even have, except for landlines, you didn't have any form of communication. Even trial was not in place at that moment. So because of that, and the lack of adequate infrastructure, we were unable at that constitutional conference able to push through the issue of e-voting or electronic voting. Then I had also the privilege under Obasanjo in 2005 to serve as a member of the National Political Reform Conference. And that was quite a very, very contentious issue because Obasanjo had sent a team, I think headed by Jerry Gana, to India to overstudy their transition from manual voting to e-voting. And the Indian experience was such that they started to stagger their elections and started to apply those processes. And the Indian team that they met with in India came and visited us during the processes of the National Political Reform Conference that was that we had in 2005. We also looked at that. And I think one of the agencies under the Ministry of Science and Technology then, Nasina, I think, Nasima, yes, one of the agencies, I think, also had developed a process of electronic voting. And we did a trial of that during the processes of the Nasima, during the processes of the National Political Reform Conference. And it became obvious that the future of elections all over the world was gravitating towards electronic voting, in spite of the fact that we have also seen, even in developed democracies, it has been a subject of contention. Even of recent, if you remember I think it was Bush and Al Gore election that became a form of, a subject of contention, the electoral processes. So even that one is not a perfect system, but I think it's a much, much better in terms of cost effectiveness, and we cannot avoid it. I was looking at my phone. On Monday, the 21st of this month, I got a new policy that has been issued by INEC. There's a new policy, electoral policy. They call it Policy on Conducting Elections in the Context of the COVID-19 Pandemic. So even INEC on its own has started to look at this, because right now we are confronted with some few challenges. There are supposed to be 4 by-elections. I think 2 in Bayelsa, senatorial by-elections, 1 in Plateau as a result of the death of the senator in Plateau, and 1 other state. So there are supposed to be 4 by-elections. But because these by-elections are not time-frame, and because we are in the midst of this pandemic, they ought to have taken place. But because of issues relating to mass gathering, social distancing, personal hygiene, I think INEC has decided to step down. But they are confronted with 2 elections that it will become constitutionally impossible for them to shift: the Ondo and the Edo governorship elections. They have issued guidelines, they have even given out the time limit for this. But of interest, to answer your question, they have as Article 6 of these guidelines, ICT and voter registration. And the item 5 of that is what would give you a clear direction of where the management of INEC is going in terms of conduct of elections. And in item 5 of this Article 6, they mention the fact that INEC will pilot the use of electronic voting machines at the earliest possible time, not Edo and Ondo elections, but work towards the full introduction of electronic voting in major elections starting from 2021. So you can see, and that brings me to my concluding remarks. The world will never be the same again. And Nigeria is not an island. And it has become very, very obvious that we must begin to think in the direction in which the world has already gone ahead. In January, if you told me that we will have Federal Executive Council not congregating in the council chambers, I would tell you it's not possible. But we have had two now. We are going to the third one. If you said our president would not have to physically travel to any of the West African countries to hold ECOWAS meeting, I would tell you no. But they have had one virtual meeting. They have had even that of the non-aligned nations. And we continue to have conferences of the National Economic Council virtually. We've had video conferencing with the Governors Forum. We've had with the co-COVID. We've had with even leadership of the religious organizations. So the world has moved as a result of the COVID-19 pandemic. And we must begin to place strategically our national infrastructure to respond to that. As to whether we would vote in 2023 electronically or not, out of compulsion, we must begin to think in that direction. Because that's the only way. I can see America even struggling with the issue of the November 20th election already. And the chances are that most of the votes would have to be postal votes. Though there are some disputations with regards to that, but the fact of the matter is that their legislation provides for that. It provides for delayed votes, it provides for early voting, it provides for postal votes. Nigeria will not continue in the same way. Our normal has ceased. A new normal has issued or has been foisted on us as a nation. And I believe that that is the only way we can be players in the future. Thank you.
Thank you very much. That brings us to the end of the national briefing for Wednesday, 27th May 2020. A number of messages have come out of today's briefing. The first is to our children. As our children share in the impact of COVID-19, our concern for a safe and secured future must remain very critical. States, local government, proprietors, administrators must play their roles to facilitate an early and safe reopening of our education sector. 2, this is to all Nigerians. The government feels the economic pains you are passing through. Government, on account of this, ensures that the gradual reopening of the economy also serves as a strategy for a post-COVID-19 economy. The third one is to our farmers. Food security is critical to national security. We encourage our farmers, extension workers, and other players in the agricultural production chain to go back to work to ensure that availability of food for Nigerians is underscored. Finally, wear a mask to reduce the spread of droplets and minimize exposure. studies have shown that it can curb up to 75% of spread. I thank you very much. God bless Nigeria. We see you tomorrow, by the grace of God.